Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. Today on the program, private hospitals threatening to withdraw their PhilHealth accreditation due to unpaid claims.
I wish that Dr. Jimenez, who placed this ad, would have contacted us directly.
Challenging the rollout of the universal healthcare law.
Unti-unti siya na binubuo mo. Parang Lego yan no? Nakuha mo yung isang pyesa dito, gano'n. Ngayon, meron ng malinaw na hubog o shape yung atin inaasam-asam na universal healthcare.
Also, the Health Department intensifying its immunization programs.
Importante po para po natitrace namin at kailangan po namin ma-follow up yung mga bata, lalong-lalo na po yung master list.
Following the return of polio and other infectious diseases.
We are concerned that there may be other people who have been exposed to this virus, and there could potentially be other cases.
And how is the Health Department monitoring vaping-related illnesses? Health Secretary Francisco Duque III joins us live. Thank you for joining us. I'm Pinky Webb. The Private Hospitals Association of the Philippines warns the Philippine Health Insurance Corporation, or PhilHealth, that some private hospitals will no longer seek accreditation from PhilHealth due to unpaid reimbursements. But how will this move impact the implementation of the universal healthcare law? Also, the Health Department's intensified immunization program, an update on polio and the resurgence of other infectious diseases. Let's go straight to the source of the story. We have here Health Secretary Francisco Duque III. Secretary, good to have you.
Yes, good morning. In behalf of the DOH, thank you.
So, the Health Department, again, conducting a door-to-door, it's called a supplemental vaccination program that started, I believe, mid-October to about the end of October in Metro Manila and some parts of Mindanao. Sir, first of all, why is it a supplemental vaccination program?
Well, it actually began August 19. And technically, if you want to improve coverage, and the challenge now is to reach 95% polio immunization coverage, for below 5-year-old children. Okay, so that is the technically you call a supplemental immunization activity. So that's what we did.
So 5 years old and below, sir. Again, explain to us how many doses are needed and at what intervals, Secretary?
Well, normally at 1 year of age, dapat kumpleto na yung tatlo mo. Okay, yung first to 3 doses at 2 drops per dose, and then followed finally by 1 dose of inactivated polio vaccine.
Which is an injection?
It's an injection to cover all 3 strains of the polio virus.
But we're not even in the injection stage yet, Secretary.
Oh, ngayon wala pa. Pero meron tayong injection. It's just that it's quite expensive, so it's a problem, no? So we have to address that, and it's a very limited supply.
I see. But if you have all 3 doses, and wala po kayo nung 4th sana, which is the injection, are you safe from polio?
You should still be safe if you have the 3 doses, except that, of course, nagkaroon ng re-emergence ng type 2 polio, vaccine-derived polio virus.
Right. So, ilan ho ba ang type, sir?
Tatlo.
Tatlo. 1, 2, and 3.
That's right.
The story that we've been following, of course, is that after 19 years, nagkaroon ng re-emergence ng type 2.
Well, it is a vaccine-derived polio virus type 2 or strain 2. The WHO is saying that we still have our polio-free certification, because what we are reporting is not the wild polio virus, rather the vaccine-derived polio virus.
Sa Tagalog po, Secretary, ano ba ang ibig sabihin ng vaccine-derived? Because some people might actually be a little wary of that.
Yes.
Kasi parang sinasabi, galing sa bakuna. Vaccine-derived eh. Yeah.
Well, ganito kasi yan ang patak, okay, it goes through sa mouth and into the gut, to the intestine. So magkakaroon ka ng shedding sa waste material, between
Sa dumi mo.
from 2 to 6 weeks sa dumi mo. Okay. So you shed that. Okay. As an offshoot of the patak, talagang meron shedding. But to prevent the mutation of that virus and reassume its virulence of the wild polio type virus, you need to have 95% or more polio coverage. So that's the way it is.
Ibig sabihin,
Herd immunity.
ano yun, sir?
Herd.
Ah,
H-E-R-D.
yes, H-E-R-D.
Oo,
Ibig
ibig sabihin,
sabihin-
babakuran mo with people, majority may bakuna, so yung konti lang na hindi na bakuna, yung virus hindi makakaalpas. At kung galing sa labas, hindi rin makakapasok.
Parang kino-contain sila.
Exactly.
No? Secretary. But let's get an update on the cases. How many do you have recorded so
2
far?
up to now.
Still.
Confirmed cases by RITM. 2, one in Marugong, which I visited. The child, I saw the child
Okay,
myself.
how is the child?
She's okay, but she continues to be monitored. And then there's another one, a boy from Calamba, Laguna, 5-year-old. The other one is 3-year-old girl. The second one is an immunocompromised with a lot of pre-existing conditions.
Ibig sabihin, sir,
Biliary
mahina na
atresia,
siya?
Mahina na siya. Oo. So nagkaroon siya ng polio virus, vaccination. And so yun, nakita type 2 din. But it is not the typical type 2.
What would you say? Mahina na type 2, ganun ho ba yung...
Hindi nga masabi kung ano siyang klase. They're really baffled. Even WHO technical, the experts are saying it's not, kasi kukumpara mo sa data bank mo, di ba?
Nung type 2 in the past.
Yung type 2 yung type 2 ngayon.
Yeah, compared to the type 2 in the past.
That's right. Yung dito sa Calamba, Laguna child, yung case niya, atypical. Type 2 siya pero atypical. So it's a very interesting case that needs further investigation.
But is that fatal, Secretary?
It can be fatal in 0.1% of those infected.
0.1%.
Yeah,
1%. So,
During
okay.
the acute phase.
So, for the information of the public, sir, ang kailangan ho talaga 5 years old and below. Is it 5 and below or below 5, sir?
Below 5 years of age.
Below 5 years of age, dapat matapos
0
nyo
to
yung...
59 months of age.
Dapat matapos po nila yung 3
Ngayon,
doses.
sa supplemental immunization activity natin, itong patak kontra polio, dapat makuha natin yung 95%. So, I would like to congratulate Davao City for scoring 100% of their target.
Very good.
And the next would be Davao del Sur at 83%.
Yeah.
And
How
then
about Marawi?
NCR is 65%. So medyo
Mababa pa yun,
mababa pa. But we still have today, they're ongoing
Yeah.
until Friday.
Yeah, parang hanggang
The
October 27
Yeah,
ata, sir.
that's
So
right.
it's an on... And the last thing about this, Secretary, what I read is that even if they have been vaccinated before, your suggestion is basta ipagpatuloy because there's no such thing as an overdose.
Yeah,
Ibig sabihin,
no
pwedeng
problem.
ulitin yung kanilang vaccination.
Oo, kesa mag-aantay ka, maghanap ka ng kanyang health record, immunization record,
Right.
bigyan mo na. Because, time, time is ticking, so you better cover as much as you can.
You know, Secretary, when we have had you the past couple of interviews, you always sounded the alarm on the immunization program of the
course.
government na pababa ng pababa. Then, because of the issue of dengue vaxxia. But we have a chart here on the vaccination trend in the last 4 years. It seems that gumaganda naman ata yung vaccination program, immunization program ng gobyerno.
Well, bumaba siya in 2018 because of primarily a myriad of reasons. No? Number one is the worsening, the controversy brought about by the dengue vaxxia that really affected the confidence and trust of our people in the immunization program of the DOH.
Right. But I want to bring this in because if, one of the illnesses that we're talking about is called diphtheria, sir, no? In 2018, right, bumaba din po siya from 69 to 65%. This is the vaccination trend. And then OPV, yung measles also is something that needs to be looked into. Secretary, we need to discuss that. Also, a downtrend there at 67%. Pero yung fully immunized child, ano ho ba yan? Because yan
0 to 1 year old children. So, yan yung kompleto na. about 8 or 9 antigens. So because you have like about 9 to 10 antigens: diphtheria, pertussis, tetanus, measles, rubella, mumps. Then you have oral poliovirus, a vaccine, and then you have hepatitis B, and then you have Haemophilus influenza type B1.
So pag sinabing fully immunized child,
Dapat yun, kuha na lahat yun in
lahat
the
yun,
first
pasok
year.
na. Well, at least that's good because that increased from 61 to 66%
Yes,
in
thankfully.
2018. Is there a cause for concern, sir, on any of the siguro illnesses na nagkakaroon po ng siguro reemergence or dumadami? Where are you focusing right now aside from polio?
Well, you have the media got hold of, like meningoxemia, diphtheria. But if you look at the numbers, they remain to be sporadic. Ibig sabihin, hindi siya, ang attack rate very, very low.
How about HIV, sir?
HIV is a concern because we have been posting the highest percentage increase in terms of our HIV/AIDS burden. We're about close to 80,000 cases. So we are addressing this in many fronts. Number one, yung prevention education campaign.
How?
Okay. Of course.
Spearheaded by the DOH,
Yes,
sir?
the DOH together with the local government
LGUs.
units, the civil society organizations, development partners. So marami tayong mga katuwang or partners. No? But yung prevention kasi is very important. That's why the testing is also equally important. Yung problema natin, wala tayong mandatory testing. It's voluntary. So we just have to keep explaining that having oneself tested will be good because at least you'll be able to pick it up rather than pick it up late when your immune system has been completely devastated by the virus and therefore rendering yourself prone to many other infectious diseases which normally won't affect a normal individual.
Yung malusog.
Yung malusog. So in other words, pati yung mga yung mga walang kwentang mga mikrobyo na tayo ngayon, meron tayo, pag naman tayo kakasakit. Yeah. Kung bagsak ang immune system mo, na yun naman ang ginagawa ng HIV/AIDS virus, talagang waratin yung iyong immune system, then you become overwhelmed by all these...
Natatalo ka.
Yeah, parasitic, viral, bacterial infection.
But before we go na break, sir, my question is, bakit ho tumaas? Because I think the data from the United Nations on AIDS is that we increased from 2010 to 2018 at 200%, if I'm not mistaken, sir, when there is actually a downward trend. What happened?
Well, the 200%, I'm not sure where the UN AIDS program on program on HIV/AIDS, they got it. Ang sa amin kasi is 144% increase. But it's still huge, okay? But the thing is, we continue to have the lowest HIV/AIDS burden in Southeast Asia. Unlike, Thailand, Indonesia, they have about more than 500,000, 500,000. Tayo about 77 to 80,000 cases.
Right.
But it's no excuse to be complacent. That's why we have to attack the problem in many fronts, and one of which is a heightened IEC campaign, information, education, communications campaign on how to prevent HIV/AIDS virus and how it is transmitted so that vulnerable populations like us, men having sex with men, so yan ang pinakamataas, 81% of those with HIV/AIDS account for men having sex with men.
We'll be taking a short break. When we come back. Private hospitals threatening not to renew their PhilHealth accreditation. But can they do that? Health Secretary Francisco Duque shares his thoughts after the break. This is The Source on CNN Philippines. Please stay tuned. You're watching The Source on CNN Philippines. Our guest today, Health Secretary Francisco Duque. Sir, before we leave the issue on HIV, how would you describe the this increase in people infected with HIV or people living with AIDS, di ba? Ganun ho ang tawag sa mga Pilipino.
Yeah.
Is it
Alarming. That's why the efforts, both of the national and the local government units, I think this is one good case for renationalizing the healthcare system of this country. Because sometimes, gusto ng DOH gawin ito, pagdating sa LGU, hindi, oo, kasi meron silang autonomy, local government autonomy. If the local chief executive doesn't make it his priority, he has some other priorities, and then, nakakompromiso yung kalusugan ng kanyang mga mamamayan. At kami sasalo, usually. Ganoon na nangyayari.
Babalik sa inyo
Babalik sa amin. So, why don't we just renationalize? This is one good case. Immunization, weakness in the immunization. Dahil, at kunyari, programa ng LGU.
You've been talking about this for quite a long time, sir. In
I've
fact.
been harping on this
Okay,
for the
let's
longest
talk
time.
about PhilHealth. Is this a problem, sir? You have hundreds of members of PHAPI, which is Private Hospitals Association of the Philippines, rather, threatening to get out of PhilHealth. Basically, aalis sila sa PhilHealth kasi daw hindi sila nababayaran ng utang ng gobyerno sa kanila, sir.
Well, sana naman yung kanilang banta ay hindi nila itutuloy dahil marami hong makakawawa dyan. Una-una mga pasyente na kung saan andun po ang mga pribadong mga pagamutan at ang mga pagamutan na yan din ang mawawalan ng kita at baka hindi na nila matustusan yung kanilang operations. So, mahirap po yan. At higit sa lahat, kawawa dyan yung mga pasyente.
But can they? Can they
palagi ko hindi naman
get
nila
out? I mean, can they even say that ayaw na namin magpa-accredit sa PhilHealth? Is that a
mahirap, madali
possibility?
siguro sabihin pero mahirap gawin yon.
Pero it's legal.
It's their choice, if they would like to do that on their own, there's no law prohibiting them or barring them from doing so, but it's not good because you're talking about patients, people who need help the most. So why will you shut your doors on, to people who need your services the most?
Absolutely, we need to look into that, sir. But if you were to look at their side and they're saying na hindi sila nababayaran, paano din naman yung kanilang kita or their revenue? They render services to the public, hence, however, sinasabi nila, they're not being paid.
Well, meron ho kasing kadahilanan. That's why they're not being paid. Una-una, yung hindi kumpleto ang mga dokumento. Kadalasan yan. Pangalawa, ang PhilHealth, mandato rin yan na siguraduhin malinis yung mga dokumento. Hindi pwedeng may mga daya o hindi pwedeng may mga palusot o fraud. Upcasing, gaming, kung ano-anong mga ginagawa na hindi naman talaga ito kakaiba sa atin kung hindi sa lahat ng mga social protection institutions or agencies, talaga may nangyayari mga ganito. Yung mga patay, biglang kukuha ng kanilang benefits.
May sakit lang pala,
May
pero
sakit.
patay na din. Well, another case here would be WellMed, sir.
Yes,
Hindi
that's
ho
the,
ba?
the very recent case of WellMed. And there are many others which are now the subject of NBI's investigation.
Pero maaayos ho kaya ito? Kasi you're talking about PhilHealth and then I want to talk about the universal healthcare law, sir.
Yeah. Yung PhilHealth naman, syempre, there's no perfect system. Okay? The important thing is it continues to be responsive to hospitals who continue to do what's right. Because we cannot countenance also hospitals or healthcare providers who, in the face of very brazen, attempts to defraud the PhilHealth, get paid. I mean, no way, because we will have our own accountability.
But if I were to ask you, sir, saan ho ba talaga ang problema? I know it's a simplified question, but you want to look at both PhilHealth and the rights of the members of PhilHealth and also the rights of those who own hospitals. Where is the problem, sir?
Well, the first right that we need to uphold is the rights of the members.
Patients. Oh.
Patients, okay? Because they're the reason for our being. So wala naman tayo kung wala sila. Okay, so yun ang lagi natin iisipin. So sana ang private hospitals, ganoon din ang pag-iisip. Na wag gagawin yung magpapa-disaccredit sila, ihinto ang serbisyo, kasi kawawa naman yung ating mga members.
What if they do that, Secretary?
Well, first, I doubt it. Number two, if they do, it's a lose-lose situation. So it's not a solution. It is a defeatist attitude.
So it doesn't seem like you're concerned about this.
Yeah, well, the PhilHealth
"I doubt
has the
it."
money to pay all of that. They just have to make sure. Kasi sinasabi naman ng PHAPI na 2 billion. That includes all, since 10, 20 years ago na mga sinisingil nila na karamihan din dyan, denied claims na with finality.
Pagka denied claims
Wala
na with finality, you cannot collect that.
Unless you want to go to the courts and the courts will reverse the decision of PhilHealth, then that's a different story.
But I guess before I leave the subject, do you think there is truth that PhilHealth owes 2.5?
I don't know.
Magkano ho kaya ang utang sa inyong tansya if you looked into this, sir?
I don't know whether that's cumulative or PhilHealth should be the one to tell us exactly what is the current liabilities or outstanding liabilities of PhilHealth.
All right, we'll be taking another short break. We'll be right back. You're watching The Source on CNN Philippines. Our guest today, Health Secretary Francisco Duque. Sir, 5 groups are claiming there is actually a health crisis because of cuts in the health budget, understaffing, and these groups would be the Alliance of Health Workers, Health Alliance for Democracy, and other groups. Is there a health crisis, sir?
Well, because of the budget cuts, that's one big problem, okay? And our low or underspending, underinvestments in health is a problem that needs to be addressed, because the total health expenditure of the country is less than 5%. The WHO has recommended at least a 5% national health spending for as a percentage of gross domestic product. Ngayon, in terms of GDP yan, na in terms of national health budget for 4.1 trillion, ang budget na nakalaan lamang for the DOH is about 162 billion, which is very small,
Ano yung
which is about
percentage nun, sir?
3.9% only of the 4.1 trillion. Thailand has 16% of its health budget, of its national health, total national
Ang
health
baba
budget.
din pala nung ating
Ang baba
secretary.
talaga. And we've been doing as much as we can, the best as we can, with very limited resources. So naapektuhan talaga yung quality of service in terms of financing, in terms of human resource for health, and in terms of services, where the inputs to services would include, of course, diagnostics, laboratory.
So is it a
equipment,
health crisis?
Project.
Would you agree?
Well, it's very hard to say it's a crisis, kasi crisis, ibig sabihin, wala nang napupuntahan ng mga pasyenteng mga ospital o nakasara ang mga ospital, ang mga ER, wala. So it's not that kind of a crisis. There is
What
a
is it?
problem.
It's a problem?
There's a problem. It's a problem of underinvestment. Okay? And also, the more important issue that we need to address squarely is the devolved health services to the local government units.
Yeah.
So I feel it might be good to review the local
It's
government
time to do
code.
that, huh?
Yeah, we need to review and look at the metrics of health outcomes. Did the local government the devolution to LGUs of health services. The Damo education was not devolved, and yet it's health that is more technical.
Yeah.
You have thousands of diseases, no? So it might be timely to already review and look at where it scored, some gains and where it scored low in terms of health outcomes.
Before you go, sir, I just want to ask this. Universal healthcare law, that's supposed to be implemented, hindi ho ba next year na?
Yes.
And kulang po ang budget. I think what is needed is about 91 billion, and you were able to get something like 20 billion, sir, and there's a 70 billion balance. Paano?
Yeah.
What is the state of the universal healthcare law next year?
Well, since you're going to do it the first year, it is a work in progress. We need to do capacity building, yung supply side. We have to make an assessment of the current capacities of our health stations, barangay health stations. This is the basic delivery unit. And then followed by a higher level rural health units, city health centers, community district hospitals. And then, of course, that is where there is so much gap that we need to address. So as soon as we are able to assess, and in fact, PhilHealth will soon accredit them according to standards, a set of standards of quality and safety and cost effectiveness, then it should be able to roll it out.
All right.
But they need, that is also where the budgetary deficit gap is observed. No?
Right.
So the PhilHealth needs about 153 billion, but it only has about 67 billion more or less.
All right.
So ang laki ng gap.
Yun talagang problema of funding. Well, we need to go. Secretary, I hope we have you again and discuss the universal healthcare law. Maraming salamat kay Health Secretary Francisco Duque III. Thank you, sir. Thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.